If you're enjoying this Med Prep to Go Step 1 podcast, you can now get the content along with the content of the Crush Step 1 podcast ad-free in one bundle. Just go to medprep2go.com and find our new subscription podcast called Med Prep to Go Step 1 Bundle.
Hi, everyone. This is Ted O'Connell. I just want to let you know that we have launched a Step 2 QBank podcast, very similar to our Step 1 QBank podcast. Each episode will have 3 questions so that you can study on the go. We are actively recording these and plan to release a new episode every 2 weeks. We're also launching a premium podcast bundle that will include ad-free access to USMLE Step 2 Secrets podcast, as well as early and ad-free access to all of our episodes from the Step 2 QBank podcast. So please go over to our website at medprep2go.com and check these out, or you can access them wherever you get your podcasts. Thanks so much.
Hi, everyone. This is Dr. Ted O'Connell with the Med Prep to Go podcast. Today, we'll be reviewing 3 pathology questions. Just a reminder that you can find these and many more at medprep2go.com. If you have any feedback or you want to get involved helping to develop this question bank, feel free to email me at ted.medprep2go@gmail.com. If you like what we're doing, please subscribe, give us a review, and tell your friends about this podcast and our website. If you want to get some more information about me, my books, and projects, you can find that at tedxoconnell.com. All right, let's get started with the first question. A full-term infant girl is born by spontaneous vaginal delivery to a G2P1 mother. Upon physical examination, a bluish tinge to the skin and lips is immediately noted, as well as marked tachypnea. Auscultation of the heart reveals a murmur. She is taken to have an echocardiogram, which shows atrial septal defect, ventricular septal defect, and right ventricular hypoplasia. The patient is given alprostadil to stabilize her condition while surgery is scheduled. Which of the following is the most likely condition affecting this patient? A. Tetralogy of Fallot. B. Total anomalous pulmonary venous return. C. Transposition of the great vessels. D. Tricuspid atresia. Or E. Truncus arteriosus. The correct answer is D. Tricuspid atresia. In tricuspid atresia, the tricuspid valve is absent. This removes the connection between the right atrium and right ventricle, causing the right ventricle to be hypoplastic due to underuse. An atrial septal defect and ventricular septal defect are thus present to allow adequate blood flow between the right and left atria and the left and right ventricle, respectively. Other abnormalities such as ventricular septal defect, pulmonary stenosis, and transposition of the great arteries may also be present. Answer choice A, tetralogy of Fallot, is incorrect. Although tetralogy of Fallot would have a ventricular septal defect, there would actually be right ventricular hypertrophy. Answer choice B, total anomalous pulmonary venous return, is incorrect. Although total anomalous pulmonary venous return might have an atrial septal defect, there would not be any tissue size adaptations. Answer choice C, transposition of the great vessels, is incorrect. Transposition of the great vessels by definition only has a switch in positions of the aorta and pulmonary arteries. Answer choice E, truncus arteriosus, is incorrect. Truncus arteriosus presents as a single large vessel where the pulmonary trunk and aorta should have been. There is always an associated ventricular septal defect. Multiple subtypes of truncus arteriosus exist and relate to the branching pattern of the pulmonary arteries. Because the aorta contains combined output from the left and right ventricles, this results in cyanosis. The key learning point of this question: there are 5 cyanotic heart diseases which are important to remember. These conditions are characterized by right to left shunts where deoxygenated blood is put into the systemic circulation with subsequent early cyanosis. A helpful memory device is the 5-finger method, where each condition is assigned to a certain number of fingers on a hand. 1 finger up for truncus arteriosus, referring to the single common vessel that develops from the lack of division into the pulmonary trunk and aorta. 2 fingers up and crossed is transposition of the great vessels, referring to the transposition between the aorta and pulmonary trunk, causing the aorta to come off of the right ventricle and the pulmonary trunk to come off of the left ventricle. 3 fingers up is for tricuspid atresia, referring to the 3 valves of the tricuspid valve. The valve itself is absent in this condition, leading to right ventricular hypoplasia and the necessity for an atrial septal defect and ventricular septal defect. 4 fingers up for tetralogy of Fallot, referring to the 4 abnormalities associated with this condition. These abnormalities are pulmonary stenosis, right ventricular hypertrophy, overriding aorta, and ventricular septal defect. 5 fingers up for total anomalous pulmonary venous return, referring to the 5 words in the name. This condition presents with the pulmonary veins draining into the systemic circulation. A shunt between the atria is also necessary to maintain proper blood flow. Question 2. A 55-year-old man presents to the emergency department with worsening left ear pain for the past week. The ear pain originally began 2 weeks ago with redness and pain, and he developed discharge from the ear 2 days ago. He has been using over-the-counter ear drops intermittently with minimal relief. He has a history of type 2 diabetes mellitus, and his last hemoglobin A1C 1 month ago was 11%. Vital signs are temperature 39 degrees Celsius or 102.2 degrees Fahrenheit, pulse 110 beats per minute, and blood pressure is 140 over 95 millimeters of mercury. On physical examination, his left ear shows an erythematous, swollen pinna that is tender to the touch with purulent discharge noted. Posterior auricular lymphadenopathy is also present. CT scan of the head confirms the diagnosis. Which of the following is the most likely cause of the patient's symptoms? A. Acute suppurative otitis media. B. Brain abscess. C. Brain tumor. D. Malignant otitis externa. Or E. Meningitis. The correct answer is D. Malignant otitis externa. Malignant otitis externa, also called necrotizing external otitis, is a severe complication of otitis externa, most often seen in older patients with uncontrolled diabetes mellitus. It is also seen in patients infected with human immunodeficiency virus, or HIV. Patients present with severe pain, usually more severe than that found in simple otitis externa, as well as swelling and granulation tissue seen on otoscopy. It is an invasive infection of the external auditory canal and skull base, so progression of the osteomyelitis can be associated with cranial nerve palsies. Other complications include osteomyelitis of nearby bones and abscess formation. CT findings include thickening and enhancing of the soft tissue of the external auditory canal with patchy destruction of the mastoid process. Malignant otitis externa is almost always caused by Pseudomonas aeruginosa. Given the potential mortality involved with malignant otitis externa, prompt referral to otolaryngology and infectious disease is indicated. Intravenous ciprofloxacin is the usual first-line treatment, though patients with advanced disease or immunocompromising conditions may require an anti-pseudomonal beta-lactam, such as piperacillin tazobactam, ceftazidime, cefepime, or meropenem, in addition to ciprofloxacin. The key learning point: malignant otitis externa is a severe complication of otitis externa, most often seen in older patients with uncontrolled diabetes mellitus, and it presents with exquisite ear pain and otorrhea, which do not respond to typical topical treatments used for simple otitis externa. Question 3. A 4-year-old girl is brought to the pediatric clinic by her father with right ear pain and fever for the past 4 days. She has been pulling her left ear frequently for relief. She did have a sore throat and fever last year, which was treated with antibiotics. The patient's father reports urticaria occurred following treatment with penicillin. Her temperature today is 38 degrees Celsius, or 100.4 degrees Fahrenheit. Pulse is 110 beats per minute. Respirations are 22 per minute. And blood pressure is 110/60 millimeters of mercury. Physical examination shows an opaque, bulging tympanic membrane with diminished light reflex. Which of the following is the most appropriate treatment for the patient's condition? A. Oral amoxicillin. B. Oral amoxicillin clavulanate. C. Oral azithromycin. D. Topical ciprofloxacin. Or E. Tympanic tube placement. The correct answer is C. Oral azithromycin. Acute otitis media often presents with fever and ear pain that is relieved with pulling on the pinna. Acute otitis media is most often caused by Streptococcus pneumoniae. Otoscopy shows an opaque, bulging tympanic membrane with diminished light reflex, which are signs of fluid behind the ear. Treatment is predominantly supportive. Acute symptoms and signs of acute otitis media often resolve within 3 days, whether antibiotics are used or not. However, in children with otorrhea, bilateral acute otitis media, signs of worsening illness, or prolonged symptoms, antibiotics can be considered. The child in this vignette has already had symptoms for 4 days. Amoxicillin is a first-line agent for acute otitis media. In patients with a penicillin allergy, like the child in the vignette, a macrolide such as azithromycin is a treatment of choice. For cases of acute otitis media refractory to amoxicillin, amoxicillin clavulanate can be used. In acute otitis media refractory to medical treatment, or in recurrent acute otitis media, tympanic tube should be considered. The key learning point: if an antibiotic is prescribed for a patient with acute otitis media and a history of penicillin allergy, a macrolide is the treatment of choice. That's it for this episode, but don't forget to check out our other episodes. And a reminder that you can find all of these questions and many more at medprep2go.com. And if you want to see some of the source material behind these questions, check out the Crush Step 1 podcast as well. Thanks, and we'll see you at the next episode.